This segment sponsored by Hope Health Systems.
So you may have heard about the staff member shot at Frederick Douglass High School back in February. Well, these types of events can have lasting impacts on someone. Dr. Jonathan Shepard from Hope Health Systems joins us today on how to deal with those aftermath behavior. How are you?
I'm doing okay.
So let's talk about trauma and the effects that it can really have on people.
Okay. Well, trauma is something where a person has experienced a frightful event, one that has exposed them to something that could have hurt or either killed them. And so those type of events are something that has to be dealt with. It may be physical abuse, sexual abuse, domestic violence, just something that could have hurt someone or harmed someone.
So how do we move past dealing with this type of behavior?
So first thing, we have to acknowledge it. It's interesting that when a traumatic experience occurs, people don't want to acknowledge. They want to hide it and say,
yeah, real talk.
Try to forget about it. Let's move on, press forward. But just acknowledging it actually really helps people to realize that they have suffered something that could have hurt or either killed them.
Yeah.
So the acknowledgement, also the consistency, trying to get back to those routines that helps a person be comfortable in moving back into their normal way of living. So you may want to be able to get that person back to, like for a child, to school. So the child might have been hurt. So you want to make sure that the child can get back to how he's been learning, where, a place of safety, place around familiarity with his friends and families and things like that. An adult, you want to make sure they can get back into either working or whatever they were doing prior to. So those two things are really important as far as getting a person to help understand what is necessary for them to heal from the trauma. And then as you begin to see how those persons are responding to getting them back to those routines, there may be extra help that may be needed, where it comes through counseling or some type of other psychological or psychiatric services.
So are there certain type of, symptoms that we can look out for? For
sure. So like even for children and adults, there could be trouble sleeping. So they're not able to sleep at night, decreased sleeping. Hypervigilance, which means that there's an exaggerated startle response. So if a person may have heard a gunshot and then they hear a car backfire and they duck or run, that type of startled response, or just hearing a loud door crash or slammed, just things like that. So hyper startled response, trouble sleeping, decreased attention, increased aggressiveness behaviors or irritability. So some of those things that you would know that that person's not functioning properly. That's probably an easier way to say it.
But the good thing, Hope Health offers many services.
Yes.
Let's talk about that.
Yeah, so Hope Health offers an array of services that will help those persons who have experienced traumatic experiences. We offer individual counseling, family counseling, psychiatric treatment for those who are in need of medications.
Good to know.
Yes, to reduce those symptoms. We also offer wraparound services, case management, rehabilitation services, where we go out into the person's home to provide that extra support and care that they may need to move beyond these traumatic experiences.
And the good news, you guys will be at the BMORE Healthy Expo.
That's right.
Tell us more.
That's right. We'll be back. Last year was a success. We really enjoyed ourselves at the expo.
Good.
It's a tremendous experience. We're going to be back there doing assessments, screenings, depression screenings.
Oh, I like that.
Yeah. So just real quick, assessments to see how people are functioning. We also have a little entertainment for the children. We have face painting.
Nice.
Last year we had like a long line.
I remember.
It was like a 30, 45-minute wait. But it was worth the wait,
Yes.
and so we're bringing back those persons. So bring your family. I think we're booth 414. I remember that. So,
nice.
So please come on and see our faces over there. We'll be glad to service you.
Well, thank you so much. Always a pleasure when you come on.
Oh, thank you.
All right, guys, let's take a look at